If you're an employer with 50 or more full-time equivalent employees, the federal government considers you an applicable large employer, or ALE. As a result, you must follow specific requirements set forth by the Affordable Care Act. One of these requirements is offering at least 95% of full-time employees and their dependents health coverage that meets minimum value. That leaves ALEs with two big questions. Which health plans are considered minimum value? And how do you know if the one you're offering meets that requirement? In this video, I'll cover what you need to know. What is minimum value? Minimum value is a standard for measuring job-based coverage to ensure it provides at least the minimum coverage mandated by the ACA's Employer Shared Responsibility provisions. Employer-provided health coverage meets minimum value if both of these situations apply. The plan pays at least 60% of the total cost of medical services for the standard population. The plan benefits include substantial coverage of physician services and inpatient hospital services. How do I know if my health coverage offers minimum value? Generally, if you provide an employer-sponsored plan that covers at least 60% of the total cost of what's covered under the plan, including physician services and inpatient care, then your policy meets minimum value standards. If you're unsure if your plan meets this requirement, you'll need to run some calculations to see if it's compliant. The easiest way to determine if your health coverage offers minimum value is by using the Department of Health and Human Services Minimum Value Calculator. We've provided a link to this calculator in the description. To calculate minimum value, you simply enter the information the calculator requests about your plan, such as its deductibles and copays. Then it'll tell you whether or not your plan provides minimum value. What happens if I don't provide a plan with minimum value? If you're an ALE who doesn't provide compliant health insurance policies to your employees, you may have to pay a fine for not complying with minimum value standards. Does a health reimbursement arrangement meet minimum value standards? If you want to offer a health reimbursement arrangement, or HRA, as a standalone health benefit, the individual coverage HRA is a great option. Through an ICHRA, your employees purchase their own qualifying individual health insurance and other medical care, and then you reimburse them tax-free up to a monthly allowance amount of your choosing. As a general rule, ICHRAs use the lowest-priced Silver benchmark plan on the health insurance marketplace as a benchmark for determining whether the ICHRA is affordable and has minimum value coverage. Silver plans provide coverage that exceeds minimum value, so the IRS considers ICHRAs that cover the cost of a Silver plan as plans that meet minimum value for its participants. When it comes to employer-sponsored coverage, not all job-based health plans are created equal. Choosing a qualified health plan that meets minimum value is essential for ALEs to stay compliant and attract and retain employees seeking meaningful coverage from their employer-sponsored plan. To learn more, you can read our article on this topic. We provided a link to it in the description. If you're an employer looking to provide employee health benefits, PeopleKeep can help. Our ICHRA administration platform makes it easy to set up and manage your personalized health benefit in just minutes each month. If you found this video helpful, be sure to give us a like and subscribe to our channel for more employee benefits and small business tips. Thanks for watching.